Monkeypox has arrived in the United States, and with the United States ordering 13 million doses of smallpox vaccines, you might be wondering, should you be concerned? My name is Dr. Adam Goodcoff, and today we're going to cover the monkeypox disease that has popped up right here in America. You've likely seen these pictures in the news. This week, an American in Massachusetts was confirmed to have contracted monkeypox. Your first thought might be that this disease is not even real. Chickenpox? Sure, but I've never heard of monkeypox. Well, that's for good reason. First of all, monkeypox is relatively rare, so much so that there's not even a clear number as to how many cases are found each year. The estimate is somewhere between 100 to 300 cases worldwide. That said, there are likely more cases than confirmed by lab tests, and that is due to the location where monkeypox is found. You see, location has a lot to do with what we are familiar with in the world. For example, this McDonald's McSpicy Paneer might seem odd to you. However, that's just because we don't have it here in the US. They're actually quite common in India. The point is that monkeypox has essentially been confined to Central Africa and less often West Africa, meaning that, like the McSpicy Paneer, it exists, we just don't see it here. The virus itself is passed from either an animal bite or from animal fluids such as saliva, blood, or even a ruptured blister, the latter being a much more common route of transmission in humans. So now that you know where monkeypox comes from and how people get it, what does it actually look like? First off, it takes around 12 to 14 days after exposure to see any symptoms of the virus. We call this incubation, and we're likely all experts on incubation periods after these last few years. The symptoms that are often seen with the virus are a fever, rash, chills, swollen lymph nodes, and even a headache. As you might imagine, the rash is the most common symptom, seen in up to 95% of patients. After all, pox is in the actual name. These arrive a few days after the fever sets in and have been described to crust over in the coming weeks before eventually healing with potential scarring. As you can imagine, looking at a rash can be difficult to make a diagnosis. Challenging, to say the least. This is where lab testing comes into play, which can be run to detect the presence of monkeypox virus. So how do we treat this? And how serious is it? The last time there was a monkeypox outbreak in the US was in 2003. Those who contracted the disease all survived. Unfortunately, we don't have any treatment for monkeypox to date. The good news, however, is as I mentioned above, all patients in 2003 survived with what we call supportive therapy. Things like fluids, Tylenol, pain medication, wound care, and so forth. Interestingly, monkeypox is similar to smallpox, and there are some medications that can be used to treat smallpox. It's been theorized that these may potentially also have an effect on monkeypox. So what's with the large order of smallpox vaccines? Well, in previous studies, immunization with smallpox vaccine had been shown to offer as high as 85% protection against contracting monkeypox virus. So what can you do today? First off, avoid getting bit by animals, although that should already be a daily goal. And second of all, this is considered a droplet virus. This means that frequent hand washing and sanitizing, as well as avoiding touching your nose and mouth, are essential to avoid exposure. That said, with only one case and 329 million people in the United States, you likely don't have to worry too much just yet. If you learned something in today's video, please be sure to click the thumbs up, and as always, click subscribe to have your health explained.